Older adults face a higher risk of stroke because the body naturally undergoes changes with age, especially in the cardiovascular system. Over time, arteries become less flexible and more prone to narrowing due to plaque buildup. This process, known as atherosclerosis, makes it easier for blood clots to obstruct critical pathways supplying blood to the brain. Additionally, many chronic conditions such as high blood pressure, diabetes, and heart disease become more common with age, and each significantly increases the likelihood of a stroke. Aging also weakens the heart's ability to pump efficiently, allowing clots to form and travel to the brain. Moreover, the natural decline in the body's repair mechanisms makes older individuals less able to recover from vascular injuries. These factors combine to create an environment where stroke risk rises sharply after age 60. While aging cannot be avoided, understanding why older adults are more vulnerable helps families focus on prevention, early detection, and timely medical care. High blood pressure, or hypertension, is the leading cause of stroke in older adults. Constantly elevated pressure damages the inner walls of blood vessels, making them weaker and more likely to rupture or become blocked. Over time, hypertension accelerates the formation of plaque inside arteries, narrowing the channels through which blood flows to the brain. This increases the risk of both ischemic stroke, caused by a blockage, and hemorrhagic stroke, caused by a ruptured blood vessel. Many older adults have uncontrolled high blood pressure without realizing it because the condition often produces no noticeable symptoms. Regular monitoring is essential, as early treatment with lifestyle modifications or medication can drastically reduce stroke risk. For seniors, maintaining healthy blood pressure is one of the most effective ways to prevent a potentially life-threatening event. Recognizing hypertension as the top cause reinforces the importance of consistent medical follow-up and proper management. Diabetes significantly increases the risk of stroke because high blood sugar damages blood vessels throughout the body, including those in the brain. Over time, elevated glucose levels weaken vessel walls, increase inflammation, and accelerate the buildup of fatty deposits known as plaque. This makes arteries more likely to become blocked, restricting blood flow and causing ischemic stroke. Additionally, diabetes often coexists with other risk factors like hypertension, high cholesterol, and obesity, which further compound the danger. Many older adults have lived with diabetes for decades, giving the disease more time to cause silent but progressive vascular damage. Poorly controlled diabetes can also impair the blood's ability to clot properly, increasing the likelihood that small clots will form and travel to the brain. Effective management of blood sugar through diet, medication, and routine monitoring plays a critical role in reducing stroke risk. By understanding the connection between diabetes and vascular damage, families can take steps to protect older loved ones. High cholesterol contributes to stroke by promoting the formation of plaque in the arteries. When cholesterol levels remain high for many years, fatty deposits accumulate on artery walls, causing them to narrow and harden. This reduction in blood flow increases the likelihood that a clot will form and block a vessel supplying the brain. In older adults, plaque often builds up in large arteries leading to the brain, such as the carotid arteries in the neck. If these arteries become significantly narrowed, even a small clot can trigger a stroke. High cholesterol is particularly dangerous because it rarely causes symptoms, allowing damage to progress unnoticed. Regular cholesterol checks, a balanced diet, and appropriate medication can help keep levels under control. Addressing high cholesterol early reduces the long-term risk of stroke and preserves brain health as individuals age. Atrial fibrillation AFib, a common heart rhythm disorder in older adults, is one of the most dangerous causes of stroke. In AFib, the heart beats irregularly, preventing blood from flowing smoothly. As a result, blood can pool inside the heart's chambers and form clots. If one of these clots travels to the brain, it can block a vital artery and cause a sudden, severe ischemic stroke. Strokes caused by AFib are often more disabling because they typically involve large blood vessels. Aside from AFib, other heart conditions such as heart failure, valve disorders, and coronary artery disease may also increase stroke risk. Many older adults are unaware of irregular heart rhythms until a complication occurs. Regular heart screenings, electrocardiograms, and proper treatment with blood thinners can significantly reduce the danger. Understanding the link between heart health and stroke emphasizes the importance of managing cardiovascular diseases as part of a comprehensive prevention strategy. As people age, their blood vessels naturally undergo structural changes that increase stroke risk. Arteries lose elasticity, becoming stiffer and less able to accommodate changes in blood pressure. This stiffness makes vessels more vulnerable to damage and increases the likelihood of plaque buildup. Over time, small arteries deep within the brain can become narrow and fragile, raising the risk of both ischemic and hemorrhagic strokes. The aging process also reduces the body's ability to repair damaged vessels, meaning minor injuries can accumulate over many years. Additionally, chronic inflammation, a common issue in older adults, accelerates vascular aging and weakens arterial walls. These gradual changes may go unnoticed until a stroke occurs. Recognizing blood vessel aging as a natural but modifiable risk factor helps families focus on early screening, lifestyle improvements, and proper medical management to slow the progression of vascular decline. Lifestyle plays a major role in stroke risk, especially for older adults who may have developed long-term habits over decades. Smoking damages blood vessels, raises blood pressure, and thickens the blood, making clots more likely to form. A diet high in salt, sugar, and unhealthy fats contributes to high blood pressure, diabetes, and cholesterol imbalance. Physical inactivity weakens the heart and promotes weight gain, which further increases stroke risk. Older adults who drink excessive alcohol also face higher blood pressure and greater vulnerability to irregular heart rhythms. Stress, lack of sleep, and social isolation can worsen underlying health conditions. While lifestyle factors are modifiable, they often require family support and consistency to improve. Encouraging healthier eating, regular movement, smoking cessation, and stress management can significantly reduce stroke risk in older adults. Small lifestyle changes made consistently can have a powerful protective effect. Chronic inflammation is increasingly recognized as a contributor to stroke, especially in older adults. Conditions such as arthritis, autoimmune disorders, and long-term infections can create a persistent inflammatory response in the body. This inflammation weakens blood vessel walls, promotes plaque instability, and increases the likelihood that a piece of plaque will break off and form a clot. Hidden or undiagnosed conditions, such as sleep apnea, kidney disease, or thyroid disorders, may also elevate stroke risk without producing obvious symptoms. Sleep apnea, for example, repeatedly lowers oxygen levels during the night, placing stress on the heart and blood vessels. Kidney disease affects blood pressure control and increases vascular damage. Recognizing and treating these underlying issues reduces overall stroke risk. Understanding the broader role of inflammation and hidden medical conditions helps families appreciate that stroke prevention requires a comprehensive approach, not just focusing on one or two risk factors. Many older adults take multiple medications, and incorrect usage can increase stroke risk. Missing doses of blood pressure or diabetes medications can lead to uncontrolled levels that damage arteries. Some medications may interact with one another, raising blood pressure or affecting blood clotting. Blood thinners used to prevent stroke from atrial fibrillation must be taken correctly. Too little may fail to prevent clots, while too much increases the risk of bleeding. Older adults may also self-medicate with over-the-counter drugs that raise blood pressure or interfere with prescribed treatments. Regular reviews of medication lists, doctor consultations, and family involvement can help prevent dangerous mistakes. Medication mismanagement is often overlooked but is a significant risk factor for stroke in seniors. Ensuring that older adults understand and follow their treatment plans is essential for reducing stroke risk. Stroke in older adults is not the result of a single cause, but a combination of factors that develop over time. High blood pressure, diabetes, heart disease, aging blood vessels, and lifestyle habits all interact to increase risk. The good news is that most of these factors can be managed, controlled, or improved with timely medical care and healthy daily habits. Recognizing the top causes allows families to take action: early scheduling, regular checkups, encouraging medication adherence, supporting lifestyle improvements, and watching for early warning signs. Stroke is preventable in many cases, and understanding these causes is a first step toward protection. By addressing risks today, Families can help older adults maintain their independence, mobility, and quality of life for many years to come.